So in last week's video, we spoke about medical billing in a nutshell. No fluff, straight to the point. Now you know what medical billing is, you may be wondering, should I take a class? Should I take a class? Should I do self-study? Should I just get experience on a job? We're going to be discussing these options and my recommendations, so keep watching. Let's jump into these options. There are 3 options that you can take if you want to learn medical billing. And the first option is to take a class. Now, that might be pretty obvious. Most people might think about that, but I'm going to give you some pros and cons of each of these options because there are pros and cons, and hopefully it'll help you decide which one you want to do. So the first pro of taking a class is that you are in a structured environment. You are going to learn a curriculum that someone has put together that will help you learn medical billing. It's not like you're going to have to be going to different places, and you know how we do YouTube University and we just learn bits and pieces here and there, so we don't really know if we've gotten all of it. But normally when you take a class, it is a structured class and they have a curriculum, they show you their syllabus, what they're going to be teaching you, and everything is within that class. You also may get hands-on training, and that helps you build confidence. So in some of these classes that you get, but you have to remember that you have to choose the right classes, you may be able to get like hands-on experience, and that helps build confidence. So when you go out into the world and you try to get a job, you know that you know how to bill theoretically, and you also know that you know how to bill practically because you have gotten experience in your class. Also, when learning medical billing in a class, you usually get the foundations. And the foundations for me is very important, because sometimes people learn medical billing in a different way, which I will talk about later on, but you don't really learn the foundations. You only learn a specific way. And then when it's time to do other things, you don't know how to operate that, or you don't know how to do it because you did not learn the foundation. Just like a house, you need a foundation, you need something to stand on and then be able to build from there. If you don't have a foundation, then everything will sink. So learning in a classroom setting, whether that's online or in person, most likely, most of the times, if you pick the right class, it will help you build those foundations. So how do I know all of this, you might ask? My name is Tamika. I'm a certified professional biller, and I have 17 years experience as a medical biller. I also have done 2 out of these 3 options that I have told you. I started working in a doctor's office as a biller before I got certified, and then I went and I took a class. So I've done 2 out of 3 of these options, and I actually probably done the 3rd one, which is self-study too, because I do that all now. So that is why I'm able to let you know about these options and the pros and cons. So what are the cons of taking a class? The first con is that it could be very expensive. Now, I get DMs and emails all the time, and most of the time they talk about how expensive these classes are. First, I want to say they don't always have to be expensive, but you do, or you are going to invest some type of money in these classes if you are being taught by someone else, because you have to pay for the class, you have to pay for the professor, you have to pay for all of those things. So one of the cons could be that enrolling in a class can be expensive. The second con could be that instead of just learning medical billing, which is what you want, what you signed up for, you learn all of these other things. Now, don't get me wrong, medical billing is connected closely with medical coding, but if you get into a class that is mainly talking about coding and barely covers any medical billing, then it probably won't help you out. So you probably need to check out the video that I'm gonna link above, which is speaking about how to choose a class, whether it's online or in person. How would you go about choosing a class? And the third con would be that you feel like you wasted your money because you did not learn anything. Now, I also hear many people say that, and that can be for many reasons. It could be because the class itself didn't teach you. It could be that you don't learn in an online environment, so you didn't pick up well. It could be that your teacher didn't explain things well. It could be many things. But that is another con that I hear pretty often, that you go into a class, you paid this money, and now you feel like you just didn't learn anything. Now, I do have some links below in the description box, and these are the schools and the classes that I recommend when you want to learn medical billing, because I have either done the class myself or I have worked with the instructors, and I think that they are really good. So I always recommend the ones that I have in the description box below. So when you get a chance, you can look down there and see if you're interested in doing any of the classes that's down there. So mind you, these are affiliate links. So if you click on any of them and you actually sign up for a class, I do get a small commission, but it does not affect how much you pay for the class, and it does not affect the fact that I would recommend the class, because I have been recommending them even before I became an affiliate. Now, the second option is self-study. So I have gotten some questions too about, can I just learn medical billing on my own? And of course you can. You can do anything you want to do. So here are some pros for that. In learning medical billing on your own through self-study, it is very economical, because of course now you don't have to pay for a professor or for this school or for this curriculum. So it is not going to be as expensive as signing up for a class. Also, you can do it on your own pace, at your own time. So there's no set rules as far as you have to complete it within 4 months, you have to complete it, this time, you have to go on a Zoom meeting, you have to do this, you have to do that. There is no set time. You are setting all the rules, you are setting how fast you learn it, you are setting everything. And the third pro is that if for some reason you feel like after starting to learn a certain amount of information about medical billing, you might just be like, I don't like medical billing. I don't want to learn this anymore. And you don't have to worry about having spent a lot of money for it. You may have spent money on a study guide or a book about medical billing or something like that, but most likely it's not a huge investment. At least not as huge as the investment of a class would be. So if you decide, I really don't want to do this anymore, this is not for me, I think I might go into coding, something to that nature, then you can just stop. You might have invested that time or a little bit of money, but you can just let it go. Now, the cons of self-study is that there is no help. There's no instructors, there's no students that you can talk to and network with. Now, mind you, if you already know billers or something, you may be able to use them. But a lot of times when people are getting into this field or getting into this profession, they don't know other medical billers, or if they do, they don't speak to them like that. So when they have questions and they're stuck, they will have nobody to ask, because you're not officially in a class and no one's really knowing what you're studying. Like, there's just so much things. So that can be a con. You won't have help. You probably may still be lost, and that won't be good for you. The second con is not being disciplined. Now, it takes a lot of discipline to self-study anything. I don't care what it is. We're talking about medical billing, but it can be anything. And it takes a lot of discipline that most people find it hard to do. Some people don't have that discipline. Some people, it is really hard to stay disciplined. They might do it or finish it, but it was like a struggle to do. So the second con is that you don't have any discipline, so you don't complete the course. No one's, behind you. You're not accountable for anything, so you end up not actually learning medical billing. And the third con is that you don't know what to study. You don't know what to study. You feel like it's not cohesive. You're picking up things from YouTube. You're picking up things from Google. You're picking up things from something else that somebody else taught. and you feel all over the place. So you really don't know what to learn, if you're even learning everything that you're supposed to learn, and you're not as confident as you would maybe be doing it another way. And option number 3 is work experience. So you can learn medical billing in your job. You might already be working in a hospital or a doctor's office, maybe in another position, and then you move to this medical billing position and they said that they would train you. So the pros for that is that, number 1, you will have on-the-job training. So you will have practical, everyday training, because with school, sometimes you get kind of like the theories, this theoretical thing. If this happens, if a patient comes in, if this claim denies, that's all theory when you're in school. But when you're on the job, you are dealing with everyday practical concerns, issues, patients, insurances, all of that stuff. So learning medical billing on the job will give you that hands-on, real-life job training. The second pro is that you're getting paid. So now you're learning how to do medical billing at your job, learning what you want to learn, but then you're also getting paid for it. So how can that not be a pro? So if you can get paid and learn what you want to learn, that's a good thing. And the third pro is that your employer may pay for you to actually take a class. So you might have started off doing billing, they're training you, and then they say, well, do you mind us sending you to a medical billing class to make sure that you're doing the right thing, to make sure that you're up on, the guidelines and changes and you know what to do? And then they end up paying for it for you. So what is better than somebody paying for your education? So that is also a pro of learning medical billing on a job. And the cons of learning medical billing on the job is not learning the fundamentals. So if you are working in, let's say, a specific specialty and you just do, let's say, mental health billing. So you were taught to do it a specific way. So you just continue to do it that specific way, not knowing if it's correct, where the information came from, any of those things. That would not be good. You won't know the foundation. So if you decide to move on to somewhere else, if you decide to open up your own billing company or whatever you want to do, you will find out that you're lost, because everything is not going to go specifically how you was doing it at this one particular doctor's office or hospital. The second con is that you make excessive errors, and that starts to affect the providers negatively. So I know some people who have been put in medical billing positions not knowing what they're supposed to do, not getting any training, and just having to wing it. And where providers may think that's okay or that's good, it really isn't. Because if the person doesn't pick on quick enough, if they don't know what to do, that provider will be losing money, and sometimes money that they cannot get back. So it would be good to know what you're doing ahead of time and not just be thrown into the fiery waters of medical billing. And the last con is whoever is training you in that job doesn't know what they're doing either. So now they're training you completely incorrect. So you're thinking you're learning how it's supposed to go, and you're doing everything wrong. And then when you finally start to do your own research, talk to other people, do different things like that, you realize that you really don't know how to do medical billing because whoever trained you incorrectly. Now, my recommendation is that you go to school to learn medical billing. Now, it all depends on what school you pick, how you learn, all of those good things. Again, watch that video so that you can decide which is best for you. But I recommend that you go to school because, number one, there is structure there. You're not learning things all over the place. This one telling you this, that one telling you that. You are learning the billing in a structured manner, and hopefully you learn everything you are supposed to learn. Now, just because you learn something in a class doesn't mean you're going to know everything. That's the next thing. Taking a class is helpful. It helps you to learn the foundations, which is one of my other points. You get to learn the foundations, but you're not going to learn everything. I think sometimes people think that medical billing is a 1 + 1 is 2, 2 + 2 is 4, and it's a straightforward thing like that. It is not. It really isn't. You kind of learn the foundations of what you have to do, and then you build from there. And sometimes you have to make exceptions and you have to change up things and all of those stuff. So it's not like you're going to learn everything you need to learn in school. It's just going to give you that basic foundation so you can then build from there. Also, it helps you build confidence. Confidence is something that you will need as a medical biller. You cannot be timid, you cannot, ask questions or decide you're not going to learn more, because then you're going to be in trouble. So going to school builds that confidence that will help you be a successful medical biller. And also this one, which I think is extremely important, is that school gives you some type of time and some type of goal. You have to have a goal set. Whether you go to school or not, you should set a goal. Because with school, whether it's a self-paced course or it's a course that you have to go to and it's a set time that you finish, you will have a certain amount of time that you can complete it. So if it's a self-paced course, you might have 6 months to complete it, and after 6 months, you can't finish it, or you have to pay again, or there's some type of consequence. You need that. And I think you need that in order to be able to finish. If you know that you have 10 years to finish this course, you're probably going to take 10 years to finish this course. But if you know that you only have 4 months, or you have 6 months, or whatever the situation is, then you will most likely finish it within that time, because you have spent your time, you have spent your money on it, and you want to complete it. So my recommendation is to go to school to become a medical biller, to learn how to do medical billing. Again, I started off with work experience, but I went back like 6 or 7 years later to actually learn it in a class, and I did not regret it. If you have any more suggestions or options that someone can take in order to learn medical billing, please leave that below, and I will see you again in my next video.